All right. So this is my consultation case study. It's ketamine assisted therapy for treatment resistant depression, and I'm Nick. Let's go. So, the case of Leroy. He is the client here. He identifies as a Mexican American male. He's got a wife and two children, one boy, one girl. He's got a good job of media science group, and he's been suffering from depression for a little bit of time now. Um, he's been on a number of SSRIs, and after each time brief success, they've kind of plateaued and then finally reverted back to normal baselines of depression and sadness and same level of symptoms. He believes he's got a chemical imbalance. Psychologically, this kind of manifests itself through negative self thought patterns and views of self, which tends to create an isolation, and he feels kind of bad for that. Self medicates with comfort food, so he's put on a little bit of weight in these past 3 years that it's really gotten kind of made a turn. Um, he's been receiving these medications from a psychiatrist while also seeing the therapist of Kaylee, who specializes in CBT treatment. Really likes Kaylee, and he doesn't want to stop seeing her while embarking on this new treatment modality through his psychiatrist agency. So his client job, he feels uninspired at work, even though it's a pretty well-paying job, but he feels stuck. He feels like he's kind of hit at everything he can. He has isolating tendencies, and he's lost a lot of his old friends he used to have, and because his isolating tendencies, he doesn't really have a lot of new ones. So he's kind of limited in his social aspects. Um, the stresses of fatherhood, as well as being a husband, his wife doesn't know how to support him. She's becoming exhausted by his lethargy. I don't know why it's funny, but it's overwhelming. Um, yeah, she misses the old Leroy. So um, these are the kind of things happening in his environment, but it's nothing really pushing him left or right, which is why he tends to see himself as just the problem is him, right? So it's those three issues that most people that suffer from negativity, its problems are pervasive, they're personal, and they're permanent. The consultee here is Kaylee. She's an LPC, has been in the field for 7 years. She specializes in CBT interventions, but she also comes from a person-centered approach. Um, she believes that Leroy tends to get stuck in these negative, limiting, self-defeating patterns, and that leads, one after the other to the kind of the social results that he's kind of dealing with. She's Caucasian and she's married, but she has no children. Leroy's been pretty active in his treatment, and he asked about these alternatives from a psychiatrist, and he really wants to start it up. And because of this, since she does meet with Leroy, she's kind of taken it upon herself to look into CAP therapy, ketamine assisted psychotherapy, for TRD, which is treatment resistant depression. And she believes that she needs to require some additional training. And then we bring in the consultant, me. So in this scenario, I'm the expert. All right. So this is like the future-oriented kind of presentation here. Welcome to the future, or this is the future talking to you in the present. So um, let's just say like I have my own private practice, and I have a partnership with like a psychiatrist that prescribes medication for my clinical patients that I work with. Um, and so Kaylee contacts me because I guess we met at a workshop, and so she's like, "Hey, can you give me some additional training? Because I have one of my clients is going to be working with a different psychiatrist through their agency, and so she wants me to help her, assist her through this process for training, and also maybe her client, depending on what happens." So this is our consultation agreement. So the model that's going to be, at least in our phase one, is going to be the consultee centered model. And then maybe as things shift, we'll kind of shift into a client-centered approach. But it seems like it's definitely going to start with consultee because she's seeking additional training from me in this one area of expertise so she can acquire it, right? So my roles are going to be first and foremost the trainer educator, the expert, and then possibly collaborator as she continues to work with Leroy if she comes to me weekly to meet about this specific case. Then we might start entering more of the terrain of this specific client-centered work, right? But when you're approaching with a working alliance model, we need to make sure that me and Kaylee's relationship, first and foremost, is solid, and that we have nice mutual respect and understanding, and it's not one up, one down, but we're working together. Right, so the duration of this is going to be, first we're going to have two weekend trainings, both Saturday and Sunday each week from 9 to 2. So it's going to be kind of like impact. We're going to go after it, um, um, and then followed by 8 week treatment, which is going to this is designed from his psychiatrist, Leroy psychiatrist, excuse me, and then we'll reevaluate after that. The payment is going to be undisclosed because that's between me and my consultees. Um, so the training that we're going to start with is just pretty much going to be a complete crash course on everything dealing with ketamine. So we'll go through the history. I don't know how to say that word, but it's an anesthetic, the neuroplastic properties, the routes of administration and dosing. This zero point 0.5 to 1.2 milligrams per kilogram is mostly like intramuscular or in intravenous infusions. Otherwise, the medication, if it's like sublingual, is a little bit more. It's like 200 micrograms per kilogram. Um, any contraindications, the side effects, the risks, etc. And because she's going to be working with him before, during, and after these types of things, I believe she mentioned, again, I created Kaylee, but in this case, in this theoretical case consultation and conceptualization, I believe she said she will be present with a psychiatrist during those medicine sessions. So it would be good to get her an understanding of what the process is, the prep and the importance of setting, right? Making sure the environment is conducive to peacefulness or to some sort of growth, and it's not like overly clinicalized or medicalized. Go over the types of questions before and after, what we're looking to get after it, what are um, different mechanisms that we can use to ground ourselves and make sure that we feel safe, like the mantras or the incantations. Integration activities. So this is that neuroplastic window that I wrote right there. After the medicine session, you have at least 48, sometimes 72 hours of like really fertile time to make changes and to really kind of reorient yourself towards what you want to see in the world. So practices of journaling, mindfulness, yoga, taking walks, those types of things. Be more active. Be really important to go over. And also just knowing what to expect, because when you're entering these non-ordinary states of consciousness, you don't really know what could possibly happen. So especially if your clients experience these types of transcendent experiences or dreamlike different visuals and hallucinations or whatever those side effects might be. It's important that you're able to understand that and to help them guide them and find some sort of positive way to incorporate that, even if it's a bad trip, right? And that's another thing, going over beforehand of the possibilities of these bad things happening, and to not frame them as bad, but also as conducive, and that the experience you had was the one you were meant to have, and how can we incorporate that into your growth in a positive way. And this is just some understanding of why ketamine is being used to treat depression, especially the treatment-resistant ones. Most of the medications that are for treatment-resistant depression, you have a lag time, 2 to 6 weeks before they even start to take effect. But the ketamine has this profound effect to have rapid onset, between 15 to 40 minutes. People are already seeing relief from their symptoms, and they feel better, and they feel more plugged in and more positive. Unfortunately, just from a single ketamine infusion session, usually it's 1 to 2 weeks, and then they're kind of back to normal, so they have to go back in for more infusions and more sessions. But that's just ketamine alone. When added with psychotherapy, it lasts a lot longer, especially with that neuroplastic window, with more openness and more willingness and actual structural brain changes happening. And the contraindications, it's a relatively safe ketamine, safe medication. Um, just like people with high blood pressure need to be really aware that it could cause certain things like heart attacks, if it is, but it's very rare, and especially when it's being monitored in session. Um, if you have allergies or if you're pregnant, that's also an absolute, you can't take it. Anyone with ketamine abuse or other active substance use are also contraindicated for this type of medication or this type of approach, or with mania, mixed state mania, and or history of psychotic disorders. So any of those, Lyra doesn't have those, so we're good. So the plan here is that we're going to be giving Kaylee the CAP training information. Leroy's going to have 12 sessions over the 8 weeks, so he's going to do it with his psychiatrist. And Kaylee's going to be present during those with the psychiatrist, so I'll give her some information on things that she could be doing to assist during that time too. Um, she'll be meeting weekly with Leroy for psychotherapy. I'll be meeting weekly with her, and this is when we'll still be doing collaborative work. Um, I'll be assisting her, but it could be a little bit more client-centered at that point, but I think consultation is still what we're going to be doing. Um, Again, I might be the expert in this one particular thing, but she's going to be the expert, or she'll be the one working with Leroy personally. Cultural considerations. One of the big ones is just this treatment approach. Even though it's becoming more medicalized, as people in this kind of capitalistic economy start figuring out how to make money, big pharma starts to get their hands on things and make changes. It is a little bit of a departure from the traditional Western treatment with medications, right? And so when we start to enter these altered state of consciousness and we start to experience social connectedness and enlightenment and oneness, it is closer to an indigenous healing, right? So it'd be important to understand where our client is. So he's a Mexican American, where he is with this type of treatment, right? And does he have any doubts and other negative views on substances? Right, and so he grew up with a darker skin tone than the rest of his family did, even though they're all of the same origin and same descent. So he's always felt like an outsider in his own family. So this could also come into play if his reflection of the culture at large, right? He's always felt like an outsider in this culture and within his family. He's got these strong Christian values. So again, he's got this typical look on types of drugs. Like seen like the late 60s, early 70s, and even 80s, the war on drugs kind of view where all medications are bad. So it'd be important to respect those feelings, but also to provide the type of education on what the substance is and the differentiations between these types of medications, or even like, since this is called psychedelic assisted therapy, what psychedelics are and how those are different than some of the other substances of abuse that you see, like your opioids or even alcohol, right? But being able to understand and respect those types of things. But he has a grandmother that used to perform medicine ceremonies in Mexico, but he doesn't really know her. But this could be an opportunity to open him up to those alternative ways of seeing things, as well as reconnecting with some of his history. Organizational aspects that could come into play. We don't really know Leroy psychiatrists, as well as the match between the orientations between what I'm going to be training Kaylee on. So if I'm telling her these things and he comes, maybe he doesn't have a lot of training, but he's got just like the medical background, there could be a little bit of distinction and differences there. So just being aware of how that can come up. And also Kaylee's cultural bias and her awareness, and she is Caucasian, on the Mexican American experience, and then my own biases as well, towards pushing these drugs, because I see the benefits of them and being able to find the right balance between those. So those all the cultural considerations are ethical considerations, but specifically with this medication, we always need to make sure that we have an awareness of the client's autonomy, the beneficence, and non-malfeasance, right? So do no harm. So we need to monitor our own feelings through countertransference, and also their transference that could be coming onto us. And then also know when the consultee may be operating outside their boundaries of competence. But the fact that Kaylee came to me and asked for this training let it kind of made it known that she's trying to bridge that gap of her own or her own ethical competence level. But just as this starts to happen and she starts to learn about these new types of things that could happen, the dissociation, the visions, the drawing out themes from imageries and images, being able to monitor that while she continues to work with Leroy to see if that maybe she is starting to get outside of her own scope and her boundaries of competence. And also just being more aware instead of drawing to those CBT, because not all CBTs are going to be really, really beneficial when you're trying to, if you experience transcendence, it's a little bit different than trying to just thought stop and cognitive restructure and monitor those types of ways. So being more open to the person-centered part of her approach, but maybe even like reading up on some psychodynamic theories and other alternative things that could be more beneficial and more in line with ketamine treatment that Leroy is going to be doing. Other one to be aware of is that ketamine is not FDA approved for treatment of depression. So going over the risks and the possible side effects with Leroy are going to be really important just to make sure that in fully informed consent can be made by all those parties involved, especially Leroy. And so since it's not FDA approved, and again, a lot of medications are off-label prescribed by different medical doctors or psychiatrists, and so it's that in itself is not something that we should just like avoid, but we just have to be, again, like fully aware that that although it is a safe medication, things could happen. So making sure that we're prepared for any sort of thing that could happen, and also to protect ourselves through documentation and those sorts of things about that we do communicate, because if things do go south, we do open ourselves up to possible legal action. If we don't have good rationalizations of why we're deciding to take this method, we could lose our license or even be like found financially or criminally liable. So the outcomes, we'll reevaluate after 8 weeks and continue sessions if we're going to need to, and we'll see how Kaylee feels of her own confidence and her need for continued consultation. Maybe we'll move to like every other week or even less than that. Or, maybe if she feels like she is beyond her scope, maybe we'll step in a little bit more. Maybe she'll finally have to refer out, even though Leroy really is like adamant on continuing with Kaylee because he has a strong connection with her. So yeah, those are the um, things that I think are important with this type of consultation. It's a little bit new, a little bit against the grain, and as we explore the alternative ways of treating some of these substances, we're going to have we'll have more and more solid ways of doing things. But right now, these are seem to be where the field is at. So that's about it.